Now this question is about clinical notes. So your philosophy behind clinical notes, why is it important to sign off on the clinical notes and get it done in a regular fashion instead of leaving them and having a whole lot of them open?
Okay, so my personal pet peeve is notes. I hate notes. I wish we didn't have to make notes, but we need notes. Because otherwise you have no idea what the heck you did 6 months ago, a year ago, 2 years ago, whatever, even last week. I mean, if you're busy, right? So you got to make notes. Mm-hmm. I don't like making notes, so I made a system for notes, right? Simple. It's just structured laziness, really. So the way we handle notes is very simple. Template out all the notes that you got to make. Doesn't mean the template's going to be perfect. By the way, it's not. It's a structure. A template is a series of headings with the most common results filled in. And what I expect after every appointment, or well, optimally, what we did was, and by the way, templates are part of a program. So if you need templates for every clinical note, just ask, and we'll just give you ours so you have something to use. We put them into the system, to the management system, and then in the morning we would just populate them all in the appointments for the day. And then as the appointment is happening, the assistant can just plug in the surfaces and whatever tooth numbers need to be updated, and then put their initial, but not mine. Okay, so I would know that they are done with the note, and I would just quickly skim it at the end of the appointment. Or if I've got to run out of there, go to a hygiene check, then I might do 2 hygiene checks, then stop at any computer in the office, pull up that note, and finish off what needs to be finished off. If I do it then, it's fresh, right? By the way, one other thing I used to do is I would always, if something hit me, okay, so this is just a little like personal, maybe a paranoia thing, but part of the room setup was a sticky note pad and a pen behind me. Because always, risk management stuff, you can't turn to the assistant and say, just please put in the note, one-liner, the patient is nuts. Because you can't, some things you can't say, right? I would just turn around on the notepad and I'd take my glove off if I have to, and I would write down, or when it's a convenient time, specific things from a risk management perspective that need to go in this note. Because I got to make sure I cover my rear on this or this and this. Because we talked about it, but I don't know where this patient's at, whatever, just something. And I would just put the patient's name, stick it in my pocket, glove up, and get back to work. That was routine. Now maybe, with current protocol, my sticky notepad has to go in a drawer. I don't care, but it needs to be there. It needs to be close because I got to make those notes. That's because it's not going to be in the template. Then my assistant makes a template. I go back, do my risk management, check it all off, and then it's done. I don't like notes piling up because when they pile up, then it takes me more time, like in a block. And I don't have time in a block. I have time here, 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 here. And sometimes I can do it while the patient's freezing. In fact, often I did it while the patient was freezing. I would just go in and close off whatever notes were outstanding. I hate having open notes. So I like to get them all done. And I hate staying for an hour after the last patient to do that. Like, I'll tell you, when I first started, my very first day in practice, I remember it because it was July 4th, because my last patient was at I don't know, maybe it was 6 o'clock or something, or I forget. But the fireworks were going and I was still making notes. Because I saved I had only new patient exams all day. And there were so many notes, and I didn't have a system, and I'm writing storybooks that it took me 3 hours to make notes. And I'm like, oh, this is ridiculous. Who's going to do this? This is silly. We need a better process. So I started making, literally that week I made templates, and templates were used. And wow, look how fast this is. And then we refined the templates. And then, wait, you know what? My assistant can do this. And so we got into the process over time that we created the process we're using. If you're not using something like that, you're spending too much time. If you like to make your notes from scratch every time, you are burning tons of time. You should have been an author. There's no point in wasting that much time. So systemize it.
Perfect.
Okay.